Good afternoon, everybody, and thank you to the group and to Bill in particular for the invite. We're almost done, and you can see my throat is struggling already. So I'm going to speak about from a slightly different perspective than what we've heard this morning. First, I'm going to make a confession. The World Bank has not done as much about obesity as it should and can do. And I think the work that we have started some work within the bank to see what is it that the bank can do effectively and more of. So some of what you'll see is the beginnings of that report. So don't bash us too much as yet. And the two perspectives we look at on any issue is what is what we call the no-do gap. We know a lot of things, but we don't do enough about those things. So what is it that we can do to help bridge the no-do gap? So that's one perspective. The other perspective, since we are the bank, is the fiscal perspective. And I have to say, as yet, you won't see some of the early results on the economics of it because we are still working on that piece. So with all those confessions, let me get started. We talk about obesity as a ticking time bomb, and the numbers of people, adults in particular, for which we have numbers, living with obesity or overweight, it's just overwhelming. And getting this message across to our client countries, and our clients primarily are the ministries of finance, but also ministries of health and transport and agriculture, and so on and so forth. Just conveying the message that it's simply a matter of time before this becomes not just a health issue, but really an economic issue. That's what our real focus is. That's where we think we as the bank can add value. And if we look at the number of people who are living with overweight or obesity, I think one thing gets lost many a time. People think it's only the high-income countries that are dealing with these issues. The numbers tell us differently. The numbers tell us that it's actually a lot of the middle-income countries. I don't know if, oops, sorry. Oops. Yeah. So if you see, these are middle-income countries, and this is where most of the problem is. There is certainly a problem in the low-income countries as well, and some in the high-income countries, whichever age group you look at, but really the middle-income countries. And those are the countries where we often forget to pay attention. You heard quite a bit today from Latin America and many of the other countries as well. The other really important perspective, particularly from the bank's perspective, is that as per capita income increases in countries, the burden of overweight and obesity, it shifts to the poor, which, the bank's primary reason for existence is economic growth, promoting economic growth. If by promoting economic growth, we're actually going to shift the burden of obesity or overweight from the rich to the poor. So you see, these are poorer countries, and this side, I don't know how much you can see in the back, I'm going to try and think. This side are the richer countries, and the 5 bars for each country are the poorest, the next poor, and then the richest on this side. So you see in the poorer countries, I think that's India, if I remember correctly. Yes, this is India. The poorest quintile have relatively lower rates of overweight and obesity. And the rich are more likely to be overweight and obese. But as you move on to countries like Colombia, Guatemala, and Dominican Republic, you see the poor are suffering much more. The increase in overweight and obesity among the poor as countries grow on the economic growth trajectory is much more. So the poor are suffering much more. It's something that doesn't often get recognized. And then there was a lot of conversation this morning about the double burden. And as was said this morning, there are so many definitions of the double burden that we don't try and come up with one definition. But this is one mapping of overweight, obesity among women and child stunting among children on this trajectory thing. And you see that as countries go from a medium burden to a high burden to a very high burden, you can see which countries are there on the various in the various quadrants, and that helps define the strategies that we need to pursue with these countries as we help develop strategies. I think we've had a lot of conversations this morning about policies and strategies to address overweight and obesity. I still, and this is, so I won't spend too much time, but just simply say there are certainly fiscal policies, regulatory policies, education, media, in the transport sector, a lot that can be done, and then some of the more traditional nutrition interventions. And we've tried to look at what the measured effect of each of these are, and what are the factors that allow for these policies or strategies to be successful, because not every policy or strategy is successful in every context. So these are the strategies and policies that we are looking at, that we are considering in taking to scale, of course, differently in different contexts. And in doing so, we've also looked at 9 country case studies to see what worked, and in what context, and which of these, again, are scalable within different conditions. Again, I won't go through the details of this. You've heard quite a bit about all of these since the morning, but just so you're aware that these are the policies and strategies that are under consideration at the moment. Now, there's been a lot of movement. Bill asked me to talk about what are the milestones? What have the partners been doing in this space? And I have to say, in trying to map that, there's a lot that's been going on in terms of putting this agenda on the global map. I won't go through the details of this. You're familiar, most of you are familiar with all of those landmarks. But what I do want to say is that there's a lot of forthcoming reports. I think in the next 6 months, we'll be hit with a huge amount of what do we know about how to address these issues. And in that, many of them focus on NCDs, non-communicable diseases, but many of them still miss obesity and overweight. And it's something that I have not been able to understand, why a report on NCDs would not address overweight and obesity. But we've seen that over and over again, and that's something I think we really do need to try and fix. Many of the UN agencies have come up with or are coming up with new strategies. WHO has done a bunch of reports. I know USAID has a new thinking on what needs to be done. There's actually a consultation the day after tomorrow, a roundtable at CSIS on some of these issues as well, both the undernutrition and the overnutrition agenda. And like I said earlier, from the bank side, we are learning a lot. The no side, we haven't done as much on the do side. On undernutrition, we've done a lot. We've really, over the last 4 or 5 years, we've really ratcheted up our investments. But on this space, there's still, don't know why this slide is, yes. So lots of awareness, but concrete action at scale is still very elusive. On undernutrition, we've invested last year alone from the bank side over $1 billion. The previous years, another $1 billion. So huge, a big change from even 5 years ago when there was something like $300 million invested by all partners on the undernutrition stunting agenda, to where we are today, where the bank alone has invested over $1 billion each year. So huge this thing. And on this issue, Bill, let me correct you if I may. The bank brings money, yes. But I think what is more useful, what is more powerful that the bank and groups like Bloomberg, who we just heard from, bring is a convening power, is messaging and evidence to national leaders at the highest levels, as well as ministries of finance who make the decision. Because ultimately, it's not little money from the bank or big money from Bloomberg that will change the financing landscape. What will change the financing landscape on this is domestic resources. So it's mobilizing domestic resources that is absolutely critical for any of these issues. So having said that, the day after tomorrow in Bali, the bank will launch something called the Human Capital Project, and the whole focus is on investing in people. Up to now, or for many years, the bank was known as the hard infrastructure bank. Now there's been a huge shift in making it something that focuses on human capital. 3 elements of I can't say too much about it because it'll be launched on Thursday, but just enough to say that there will be a human capital index, investments in improving measurement over time, and then country engagement, working with these countries to see how we help countries to do better on the index. And the index will have 2 focus. One is health, and the other is education. Those are the most important components of human capital. And on the health side, it's under 5 mortality, which is important from an undernutrition point of view. It's adults, child stunting, which is very important from an undernutrition point of view. And the third health indicator is adult survival rates, which is closely linked to the issues that we've been talking about. And on education, it's quality of education, not just bums in the seat, but what kids are learning in school. So really the focus is going to be how do we support countries to do better in terms of these, the human capital index and the human capital index. So what can the World Bank do in this space? And like I said, don't shoot us as yet. We're trying to get our acts together to do more and better. First, as you know, as you've heard across the board, we need to act across sectors to address a complicated issue like this. So we have engagement in health, in agriculture, in transport, in macro-fiscal. All of that can be brought to bear. Second, we could potentially scale up some of the policies and interventions that many of you have talked about this morning. Third, really leveraging at the global level the advocacy that can come from the Human Capital Project around universal health coverage. Several of you talked about that. The government of Japan has committed $30 billion for UHC. So why can we not crowd in some of those resources into something like this? So on and so forth. Really moving this obesity agenda from an individual's problem to a global public good. I think that's where what's something the bank can do. And at the country level, we can use policy instruments such as development policy operations, where we have an agreement with the government to say, if you implement policy A, B, or C, some of those have been talked about, the Mexico example and others, then we release X amount of resources if those policies are implemented. We provide reimbursable advisory services. The government of Saudi Arabia calls on the bank to help them design their taxes, the SSBs, the sugary taxes. So, and then we have investment lending that we do as well. So we have a whole litany of instruments that could be applied to this agenda. One example, as somebody already talked about that, is the master plan on ciclorutas that was developed in Colombia. Actually, the World Bank's transport team had worked with the government to do that. Similarly, in Bogota, the non-motorized transport listing has been done in partnership with the government, with the World Bank's teams. So it is possible to do that. What we need to make sure is that this work with the transport team is also combined with the investment lending from the health side, so that we can actually bring to bear the impact of cross-sectoral interventions that many of you have been talking about since the morning. Nina referred to the lessons from tobacco. I think there are lots of lessons that we can learn from tobacco. And again, the bank has been very active in this space, whether on the partnership side or bringing resources, again, including domestic resources, which is usually the largest part of sustainable financing for any agenda altogether. In the interest of time, I won't go into those details, but also to emphasize that there are a few other lessons from tobacco that are absolutely critical as well, so that we can learn from those. Including issues like soft earmarks that were referred to earlier, but also this big issue around building broad alliances. And I see many people from many different walks of life that are here today that can help to do that. So let me stop there. Thank you very much.